Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. Just a quick reminder, if you like our videos, share us, tag us, tell your friends about us, like our videos, become our followers on Facebook, Instagram, YouTube, Twitter, so on and so forth. So we're going to introduce real quick. We have Joe. He's a Marine, right? And so he's coming to me. He's had a history of knee pain, a history of low back tension, pain, hypertonicity, so on and so forth. So he was explaining to me a story about his knees. He had some really bad knee pain that would not go away. He could barely get out of bed. He'd have to get out and really do some deep stretching and some deep compression to try to relieve some of this pain. We're thinking it's some sort of arthritic or degenerative change since he was in the service and was carrying a lot of weight, moving around, and may have just exacerbated some knee issues during the service. So when he came back, started taking some glucosamine chondroitin, which is normally what we recommend for joints, and he noted that the pain did diminish. So then he started doing his own knee rehab, stopped taking the glucosamine, pain started to come back. So he started aggressively rehabilitating his knees. Now he's going on a hike, doesn't really need to take glucosamine. So glucosamine is going to be, chondroitin is going to be good for a joint repair. But in this situation, and in most situations, you've got to go in there and do the work. You got to go in there and do the rehab. If you don't do the rehab, nothing's going to get better. So getting in there and using the exercise, doing the hard work to recover is what's going to be ideal for recovery. And speaking about exercise, he is a lifter, right? So he has hypertonic muscles, right? Look at him, he's showing off his guns. So he has hypertonic muscles. We were palpating. As he's telling me his story about what he's feeling, what he feels like a little bit of compression in the low back. He's been adjusted before. And just to note, he is a self-adjuster. So he actually just adjusted his neck this morning. So we may not get a lot of audible, but we're still going to get some movement in here. So at any rate, with use of weightlifting, having an active lifestyle, his muscles are pretty tight, hypertonic, right? And so with this situation, we're going to have a lot of trigger points. So as we're popping up and down the back, we get to points and it flinches, right? So these are trigger points that are exacerbated, causing nerve irritation, that we want to go ahead and use some soft tissue work, electronic stimulation, some lotions, hot packs, deep tissue therapy, and chiropractic adjustment to address, okay? Anything you want to add for us, Joe?
Visit corephysiquespt.com if you need a personal trainer. We are always ready and willing to come and make you core fit.
Very good. So after we get you core fit, you come here and we'll make your spine healthy. After and before, right? So at any rate, J-Train, let's have you set up right over here for adjustment. And we're gonna set you up here. So let's have you move just a tad forward on the chair right there for me, and then relax right back here. We're gonna try to get some movement in here. I'm gonna palpate in through here. Right there. Relax here for me. Very good. Okay. Relax right in here for me. Very good. Okay. We got some upper cervical movement here on both sides. Like I said earlier, he self-adjusted, which took away a lot of the lower tension or lower tightness buildup that we had here in the spine, but we ended up able to move the upper cervical region. Okay, let me have you lay face down right here for me. How'd that feel for you?
Felt amazing.
Good, very good. All right, let's see here. Now, if we noted on videos, right, on the exam, when I did his leg testing, he had a little bit of difficulty controlling me pushing down. So let's see how he responds after. Let's see if we get a change with that. Let me get some movement in here. So when we were palpating in here, we found a lot of his hypertonicity right in here. So you're gonna know, watch the movement here. Right, when we're going over these trigger points, it's gonna exacerbate this right here. We're gonna see this with myofascial pain syndrome. You're not gonna see this as in general, but as we roll over these trigger points, you're having that muscle response, correct?
Mm-hmm.
All right, we're gonna try to get in here and get some movement. Take a deep breath for me. Completely exhale. Very good. All right, good movement in there. Relax right here for me. Very good. Here. Very good. Okay, if you noted, that's the side that he self-adjusted, and we got movement over here. This was already gone. We still got movement in there, we just didn't get a lot of audible, which is fine. Take a deep breath. Completely exhale. Very good. Okay. Let me have you lay on your side facing this way for me. All right. We're gonna have your top leg bent and your bottom leg straight. Right there, relax right here, right there, okay. Take a deep breath, completely exhale. Very good. Lay facing the opposite way. We're gonna set up just a little bit different here. So we're gonna have your top leg bent, bottom leg straight, okay? Give me this arm right here, okay? And now I want you to roll your bottom hip forward, right there, okay? Right there. Take a deep breath, completely exhale. There it is, okay? Let me have you lay face up for me. Okay.
Oh, that one felt great.
That felt pretty good, right?
Yeah.
We're able to lock out those hips a little bit better.
Yeah.
Good. Same thing in here. Very good. Scoot up just a little bit. All right, right here, lift both legs for me. Hold them right there. Don't let me push down. Go ahead and lift it a little higher. Relax your head down. Don't let me push down. Got a little bit better strength. Do you feel a little bit more stability in the low back?
Absolutely.
All right, I'm going to help you up here. We're going to get some movement here in the wrists and the forearms.
Okay.
And then after that, we're going to use a little bit of lotion on the back, right, on those hypertonic muscles, and set you up with E-stem, okay?
Perfect.
So we're going to try to get some movement in here. Good. 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 And here. How many steps you got today on this Fitbit?
Not as many as I should. About to get a whole lot on this hike.
There it is. Lay face down right there for me. All right. We're going to use a little bit of soft tissue work here. As we're going to show with our at our visits, we try to get in here and get some soft tissue work into the muscles every time our patients are here. Pretty deep there?
Oh yeah.
Just to let you guys know, we have two massage therapists. They're both trained to do myofascial release techniques. I am also trained to do myofascial release techniques, so we're breaking up some of these trigger points here. Good. Very good. Very good. Now we're gonna set them up with electronic stimulation here. So E-stem's gonna get in here. We're gonna create a micro massage, right? We're gonna get some movement. This micro massage is eventually going to help relax some of this muscle. If we know, we already have red response here, so we brought blood to the surface with that deep tissue work here really quick. And then we're gonna let the machine get in here and help us do the rest of that, okay? So we're gonna get some movement here. We're gonna put some right in here as well. And this is gonna be the area on his chart that he identified. It's like a big X from here to here. And that's when I know that we're dealing with that myofascial tightness, pain syndrome, so on and so forth, that's causing him his issue. After we're done today with care, he's gonna feel no pain. He's gonna feel pretty good, as he's probably starting to feel pretty good right now.
Oh yeah.
All right. All right, we're gonna set up the machine here. Here comes electronic stimulation on the upper. Feel that?
Feels awesome.
Now we're gonna take it according to your tolerance level, so you tell me when to stop.
Okay. That's good.
Good. Same thing on the lower one. You tell me when to stop.
That's pretty good.
Good.
Yep.
All right, now we're gonna set up a couple of hot packs here. So like I said, guys, what we do here at our clinic, we use chiropractic adjustments, soft tissue work, hot packs, electronic stimulation. After he's done with E-stem here, we're gonna send him over to our vibro plate, so he gets the work service here at our clinic. We are a clinic who believes in spinal manipulation and movement and soft tissue rehab, along with follow-up exercise rehab to maintain spinal strength and stability and reduce symptoms. So we're gonna go ahead and put a couple of hot packs on here. We're gonna let them hang out for about 13 minutes and then we'll be right back for them. All right, thank you.